So for all of our listeners today, welcome to our Wireless Wednesday number 8. My name is Alayna and I'm a junior at AUP. I'm currently double majoring in History, Law, and Society and Environmental Studies, and I'm minoring in French. And I'm joined by my co-host, Sandra. Would you like to give an introduction?
Yes, so I'm a senior at AUP, majoring in international competitive politics and minoring in computer science. And this semester is my last semester as an undergrad.
Congratulations.
Thank you.
And today's topic for this Wireless Wednesday is on the theme of health and well-being, kind of in all of its forms at AUP. And both of its offices, I'll specify there. And so today we have with us Anne-Laure, who is the health plan coordinator. And we also have Pamela Montfort, who is one of our student guidance counselors. So I think we can begin by doing introduction. So Anne-Laure, would you like to give a quick little introduction about what your role is in the university, how long you've been in that position, and how you got involved in that?
Yes, sure. I started working for the American University in 2017. I started working as a coordinator not long after. And yeah, it's been 4 years. And I got a colleague, an assistant called Noemi, who is great. And we are helping the students with processing their claims, medical claims. We help them find doctors. If they want to find a specialist, we can help them as well. And that's about it.
Cool, thank you. And Pam?
Yes. So, hi. Thanks, first of all, for having me here. So, I'm Pamela Montfort. I'm, as you said, one of the 2 guidance counselors on campus. I've had this position since summer of 2018. So, it's going to be 3 years. And I got involved with AUP first as an academic advisor, because when I arrived in Paris, I went back to school. My first background is clinical psychology, but when I landed in Paris, I went back to school and went into career counseling. So then I got my diploma and I started working with AUP as an academic advisor first. And that was in 2013. So then in 2018, the position of guidance counselor opened up, and that's how I ended up here. And happy to be here.
Nice. I didn't know that story.
Yeah.
Well, there you go. So I prefer to say I'm not that old. It's 3 years. No, but overall, so I can say I know AUP pretty well.
Yeah. From multiple perspectives, that's for sure.
Exactly. Yeah.
And
I have that chance.
Yeah. And you kind of touched on this, Anne-Laure, but I think Pam, it would be good if we did the same, just so that students can, or people can see like what your individual offices do. So in a quick 1-2 sentences, what's the role of your office?
Do I start?
Yeah, go ahead.
Yeah, we welcome, like, students have, when students come to see us, they have different kinds of requests. They have a medical issue and they're looking for a doctor. They don't know how the insurance work, so we are the intermediary with the insurance. So we can explain how this works. We can explain how to be reimbursed. And we also help them if they have a medical condition, a pre-existing condition. We can help them set up a protocol. We can be the link between them and the hospitals if they need a medical frame. We can also help with emergencies. If the student is hospitalized, we are the link with insurance as well, but we are also sometimes in touch with the parents. And sometimes we are the ones who get in touch with the hospitals and to know what's going on. during the COVID, since the COVID situation started, like since the sanitary situation started, we began to follow up with every student who inquired about COVID, who was COVID positive or who needed to get tested. And so we followed up with this closely for 1 year now. We also, and the day-to-day, like the day-to-day tasks are still there. So we keep making sure that everyone is insured correctly, that the billing is correct. We make sure that the students know we exist, because when students come over to AUP, some of them don't know that a health office is here and what we do. And so that's why it's a great opportunity to talk about this right now. Yeah.
Thank you. And Pam, can you do the same? Can you just do a quick overview of like?
Sorry, that wasn't quick. Sorry.
A quick overview of things, because then we'll go into detail with questions.
Okay.
Sorry.
Yes, I'll try to be quick. So I would say in a few words that we're here for any student who's trying to find that balance between academics and well-being. And that can be through services such as academic accommodations, finding resources for mental health, and resources in terms of academic strategies, whether it's time management or communicating with professors, or making decisions in terms of how to go about academic issues, choices they have in order to better to find that balance with their workflow. You know, maybe sometimes it's about combining strategies with mental health and academic options such as the ones I just mentioned. So yeah, I mean, in a nutshell, it's any student who's interested in preserving or getting back to feeling balanced with their with these two big areas, mental health or well-being and academics. Cool. And this is a service that most American students know about, because most of them have it in their American institution, but not other students coming from other parts of the world. So yeah, we also try to be very visible and communicate as much as possible so that they know what we do.
Great, thank you. All right, maybe we can start with the few questions. Anne-Laure, you already mentioned it briefly, but let's just reshape that. So student, obviously they come in France first time, they don't know, they might used to see some sort of specialist and something like that. So can you help them take the appointment if they need, or do you just give them numbers, or what's the procedure? Can a student come and say, I need to see a cardiologist? Like, what can you do for them? Like, for example, like you go with them, you take the whole appointment. How does it work?
We try to kind of our mission is also to make the student to make them independent. So it's so what we set up for the past couple of years is help them set up a Doctolib account. Doctolib is a medical database that lists most of the doctors and specialists in France. So we try to teach them how to look for a doctor, but when it comes to a specialist like a cardiologist, we make research for them. We make research. Sometimes we help them, we do help them make the appointments. And when it's for a cardiologist, I would say we would make the appointment, but for a gynecologist or general practitioner, we would let the student make the appointment so they learn how to use Doctolib. So it's also, there is also an aspect of like we try to teach them how to be autonomous in Paris. And I think that's part of the global explorer experience.
Idea. But like, for example, do you like, you let them make the appointment, but do you guys have a list of doctor, maybe, because some students don't speak a word of French. It's hard to go see a doctor, explain whatever you're don't know. So do you guys have a list of doctor who maybe speak?
We do have a list of doctors. Sometimes the list is not enough, because some students, when they come over here and they see on the website the list of doctors, they think that we only work with those doctors, but that's not the case. We work with all kinds of, like, any doctor can be reimbursed, so they can go see any doctor. So we can look for new resources for them. So yeah.
Yeah.
So
I was just gonna add this list of doctors. I've definitely used that list in my time at AUP, so thank you for all that you do with that. But also it's doctors that are English speaking, because and Anne-Laure, you touched on this, but I think a huge part of your role is to kind of integrate people who might not necessarily be French into a French medical system. And you know, for if you speak English and you don't speak a word of French, the easiest way to do that is to speak with a French speaking doctor.
Yeah, definitely. We make sure that the doctor is English speaking. I must say that sometimes when there's an emergency and there is no other choice than sending the students to a doctor that we don't know, sometimes it can be like you can have surprises. Some students went to see doctors like as guinea pigs for us, and they ended up like the doctor wouldn't speak English. But sometimes we don't have any choice, because it's such an emergency that we just it's either this or
no doctor.
And we know how much. But there are more and more young doctors, so doctors speak more and more English. So that's good. But we keep prospecting all the time, and it's good because we have the students also help us, because sometimes students find someone else, and on Dr.
recommended some doctors. I know this doctor. You should.
Yeah, exactly. So you are also a resource for us. So definitely.
Cool. So we were talking about making a doctor and everything, making a doctor. Oh my God, that doesn't mean anything. Making an appointment with a doctor. So you mentioned earlier the reimbursement. So like, how does it work? Like,
I think that like the students are so confused when it comes to reimbursement. It's such, Sandra. You're French anyway, but even when you're French, it's complicated, right? It's complicated.
So the school has a partnership with an insurance, right? So it's called MSH. Yeah. Well, I don't use it, so I never remember in which order the
MSH.
So how does it work? Like, how can the student get reimbursed? What do they need reimbursed?
They need to, like, the doctor will always give a bill to the student. So that bill, we can show them how to upload that bill, how to upload it on the MSH website.
Okay, so it's pretty self-explanatory. You have the bill, you upload it, and then
exactly. And we just need the bank account information, and that's it.
How long does it take usually to get reimbursed?
It usually takes 1 week. Sometimes it takes more, and that's where we are. That's when we can step in. Because when the students say after 1 week, oh, I haven't been reimbursed, we're here, but let us know, because if you don't tell us, we will not know. So so the student comes to us and say, I haven't been reimbursed yet. So we try to investigate, and we usually find why the student haven't been reimbursed, but it usually takes 1 week.
Okay. And going back to you, Pam, like we have because you as counselor, you also like can
refer
with
thank you.
Yes.
To therapists, and would those sessions be reimbursed also by MSH, or like I know, sorry. So Like, do they all work with MSH, or so certain numbers only? Like, how does it work for that?
Yes. So MSH will cover. Yeah. So sorry. Let me start again. We work closely with MSH to get more and more therapists enrolled with them, because what happens once the insurance company gets in touch with the therapist, they check their credentials, they make sure that they are licensed to work in France and all of that. And once they're on that list, we are comfortable sending students over to those therapists. And most of them work in what we call direct billing, which means that the therapist is paid directly by the health insurance or MSH insurance. And that means that the student doesn't have to pay up front and then get reimbursed like they would do if they go to a doctor or any other specialist, including a psychiatrist, who are considered doctors, who are doctors. So yes, we work closely to develop this list because we are interested in having the more diverse city as possible in terms of everything, approach, even languages, so that it's not just English speaking therapists available, but other languages such as Spanish, Portuguese, etc. So going back to your question, yes, that's one of the things we do in the office. We refer students to off-campus therapists. And it's important to, maybe you have this question later, but I take advantage of it, to clarify that we are two on-campus counselors, but we don't provide therapy on campus. We're going to have a different focus, and we can go over that later. And that's why it's important that we have available therapists outside, so that students can really work on their mental health for pure therapy, for therapy, officially therapy outside. So that's the kind of referrals we're going to help them, we're going to do. And we work closely with two of them, two off-campus counselors, for whom we have their access to their agenda. Okay. So if a student comes and wants an appointment immediately, we're able to block an appointment already with them, which is very practical.
And how many sessions per semester can a student have, kind of included in that, like
in that program package? Yes. Thank you. Yeah, I forgot to mention this. These are 15 sessions per semester.
So it's like once a week.
Yeah, on a pace of once per week, that covers pretty much of the semester. And yeah, and for students who started late, for example, in the spring, going to a therapist, we could see the possibility of them using their sessions during the summer if they're around and they want to keep seeing the therapist. Yeah, which is
and I think you're on an important point here, which is what MSH covers. So MSH, the insurance that AUP uses or goes through, that they cover 15 sessions with a therapist or an off-campus therapist per semester, right?
Right.
Yes. Okay, I just wanted to make sure. And then Anne-Laure, maybe you can speak to this more, but what kind of things does the health insurance cover more on the physical health side?
Outside, like doctor reimbursement, maybe medication, like like X-ray or scans if you have to do any like blood work or anything like that.
Yeah, it covers all of this. I must say that 15 sessions of therapy per semester is like the best deal ever. I don't think you can see this with any other private insurance in France. It's
definitely not
impossible. Yeah. I looked and I can't find any. So yeah. Otherwise, so it covers all basic treatments, medical treatments, all basic medical care, And like all doctors, specialists are reimbursed 100%. But if you have a doctor going beyond reasonable rates, like a psychiatrist, you can be reimbursed up to 90 euros, but the rest will not be reimbursed. It's out of pocket. Ophthalmologist, eye doctor, ENT, like all those doctors, if they don't go beyond reasonable rates, it's 100% reimbursed. And you have a great deal for glasses and contacts. It's 350 euros per calendar year from January to December. So every year, basically, you can change glasses, and 350 is not, it's great. I just have 100 with, yeah, mine too. We just have 100. So yeah, so that's great. And there is a great thing too with alternative medicines. Alternative medicines, chiropractor, osteopaths, acupuncturists are reimbursed 10 sessions per semester, fully. So it's no, it's great.
Better than mine again.
Yeah. And I encourage the students, or maybe that will be another question. So
well, I was just gonna add, and medicines too, like prescriptions, right, are covered. I mean,
yeah, pharmacy medications, x-rays, ultrasounds, MRIs, it's all fully covered up to a certain amount, but and it depends on what lab you're going to. So our part at the health office is also sometimes to try to compare the prices between the labs. So we try to find, because sometimes they don't, the student don't pay at all the same price. So we try to investigate for them to find the best rate. An MRI is very expensive, but MSH reimburses a very good part of it. So yeah, that's still very interesting.
And just like, because we've been talking a lot about that insurance, how long are we covered for? Does it work for the whole calendar year? Does it work for the whole school year? Does it work per semester? How does it work?
You're covered per semester. It
Okay.
starts from September to, for fall, it starts from September till the 31st of December. And then for the spring semester, it starts on January the 1st and up until the end of August, which is interesting for spring students, because you are, even though you graduate or you finish your studies in May, you still covered until the end of the summer. So that's a good thing too.
Okay, great. I had a question regarding that insurance. There's some students like me who are French who have their own insurance, they don't need it. How can we exempt out? Because we don't have to accumulate, there's no point. So what's the procedure to exempt out of that insurance?
We need to be informed ahead of time, meaning that normally the rule is after 2 weeks, 2 weeks after orientation, we should have received documentation from the student who wants to be exempt from the insurance. The documents we need is a proof of coverage. It needs to be if you're French, the proof of coverage is enough. We also need to make sure that you have someone not far from Paris who can take care of you if something happens. So that's one of the criteria to be exempt. For a student who comes from the US or another country, we want to make sure that the coverage is enough. So we check the contract. So it's very important for us to check the list of guarantees to see if the student is covered enough. If an accident happens, we need to make sure that the student can be returned, and the insurance of the student can be covers the return of the students to their country. And so we check this before accepting the exemption.
That makes sense. Okay.
But for sure, the student need to be in touch with us, because we won't go. We don't necessarily know that the student has another insurance.
Yeah.
Except when you're French. Usually, you have one.
Yeah. Okay, great. And so, you know, we know that students that have been for a while in France, they can request French Social Security. So how does it work? I've heard terrifying stories of things lasting for a
Social
long
Security
time.
is terrifying.
But then I heard some also great story that it was really quick, and I was like, how did that happen?
Yeah, it depends. It depends whether the student has been with SMEREP before, you know, the student social security that disappeared. It no longer exists. And now they have a website, and it makes things more, it makes things easier. And you can get a social security number faster than before. But it still requires that you bring, like, that you have all your documents, birth certificate. So we make sure that the student has those documents, and we can even ourselves upload the documents on the Social Security website for foreign students, because there is a special website for foreign students now that didn't exist before. So we do that, and if the student is lucky and Social Security works well, yeah, it's very random. So when the student asks how long is it gonna take, we have no clue. We have no clue. It's really random. With
It's
Social
like a lottery ticket. You either win or you lose.
That's it. Yeah, and it's very frustrating. It's very frustrating working with them. But once you have Social Security and Carte Vitale, then it can open doors. Well, it makes reimbursements easier and faster. That's the thing. It makes you still have to pay upfront for the doctor. We all pay upfront for the doctor. We all pay upfront for it when we go to the dentist, but we reimburse faster because we have Carte Vitale.
Yeah.
And on that note, I also wanted to add, because I know you, Sandra and Anne-Laure, are French, and I'm bringing some American perspective, because the idea of paying up front for a doctor or a dentist or anything prior to coming to France, I was like,
yeah, I know.
Can I afford that? But I want to say, if you're coming from the United States and that's your only background with medicine and doctors and things like that, paying up front in France is generally a lot more affordable. You can really do it out of your wallet, like right then and there. And yeah, I've to speak to the beauty that is MSH. I have always been reimbursed within a week of submitting my my documents, and that was actually my first interaction with the health office, was learning how to do this. So yeah, paying up front is
because, for example, like dentist, for me, I go to the dentist, it's just for a cleanup or whatever, or an x-ray. It's gonna cost me out of pocket once my mutuelle take apart is what, like $30. In the States, it's definitely not $30.
How much is it in the States?
Yeah, I got my wisdom. So cheap.
Probably. But yeah, going back to like the thing you were saying, like the advantages of being covered by MSH in the spring is like it kind of goes over for the summer. Pam, can a student, even when they go back home, still use the therapist because they will still be covered with MSH?
Maybe Anne-Laure can confirm the latest we know about this policy, because what happened with before COVID, before remote learning, the student had to be here in France, but then they became a little bit more flexible when the student had to go back home. If the student started here and then left and went back home. If the student started remotely, then they wouldn't be with MSH and therefore they wouldn't be covered. As far as, if I'm not mistaken, it still applies. If the student needs to go back, they can still work with the therapist.
Yeah.
Is that right?
You're right.
Okay.
That's true. MSH made they made an exception. They agreed because those are special times. So they applied special measures. And that makes sense. So yeah.
Normally outside COVID, no. But within COVID right now, potentially we can still do that for a little bit.
That, yes, there's one scenario though that I do get this question. Can I keep working with students ask if they can keep working with the therapist they're working with back home? And in that case, the MSH wouldn't be able to cover it. Because as we were saying from the very beginning, they have to be licensed to work here in France. And that is important for sure.
And the student has to be located in France too. So the address we send to MSH is because the student, we never know where the student is going to live, so we don't have any fixed address. So we usually give the address of AUP where the student has a mailbox, and MSH uses that address. But the student definitely needs an address in France.
Okay. And going back to therapy, you mentioned that everything is outside campus. So that doesn't mean there's no therapy on campus. And if not, what do you guys do?
Right. Okay. So we don't do therapy per se. So we're not, we're here to support. Of course, we provide emotional support, and we both have a clinical background that allows us to grasp a little bit better what might be in the back end. But we're mainly here to help students find their resources, if it's a therapist or somebody else outside, but also have a help them have the academic piece to it as well. Meaning, for example, well-being has got in the way of them functioning properly and then falling behind. And then we're here to help them explore the different resources. Maybe they find a therapist, but also maybe they touch base with us every 2 weeks to a lot of students find that strategy good to be held accountable for the strategy or the plan that we put in place about how they plan to catch up with the work. So we're kind of like a bridge between off-campus resources and on-campus resources.
And can you also help, like if you're saying like a student is falling behind and is really trying to catch up and everything, is taking all the help he can get, can you be that liaison also with professors, maybe, like if the student is a little anxious to, like, because some students are not comfortable to go talk to a professor, even though we've been saying in many of our Wireless Wednesdays that you're such a small community, you will get to know your professor pretty well. But some students still like maybe a little shy, especially if it's the beginning of first semester. They'll be like, oh, I don't know what I can do or not do. So can you be that link?
Yes, of course. We're here to build that bridge between the student and the professors, because it's not because a student knows that they can reach out to the professors that is a given, that it's easy to know how to do that, whether it's by email or in person or by Zoom or
what the
Teams.
best.
Yeah, so we have different ways of approaching the situation. Same as Anne-Laure, we want them to be empowered and feel they are autonomous, and we do have a sort of a coaching role as well in terms of help them develop coping skills and help them be confronted with daily challenges like that. Sometimes we help them craft the email, or for example, sometimes we write the email, but with some sort of agreement that they'll write right after to complete what was not said in the first message, or sometimes it's in person. We invite the professor and the student, and we can have a conversation, the three of us there, because the student feels that they can't transmit the message properly. But we're always going to encourage that learning process in these actions.
And then your some of these issues are kind of, or some of the possible issues that students could come to you for, Pam, are kind of time sensitive. So how often or what is your availability, I guess, that students can reach out to you?
Okay, so we have right now it's exceptional, but normally both of us work from Monday to Friday. Right now, both of us have a day off. I'm working from Tuesday to Friday, and Charlotte, my colleague, is working from Mondays to Thursdays. And what we do, we have, and again, because of how things work on campus, but we've seen that it tends to work as well while we're working remotely, to have, while one is available for, say, for example, I have all my offerings of appointments available in the morning. Charlotte will be all available in the afternoon for whatever works best with the schedule of a student, because some students have packed mornings and others have packed afternoons. So the goal is to have one of us at least available for walk-ins or last-minute appointments. Sometimes we are both full, and in that case, their students are welcome to reach out to one of the two therapists I was mentioning before, for whom we have the agenda, and make an appointment with them directly. If they need something concerning academics, we can always find a time to do that. Yeah, it's rare that we're that full that nothing can be done that week if it's a Monday, yeah, we try to remain available or make ourselves available for requests, especially if they're urgent.
There's something else you said you help with, like learning accommodation. So here's going to be a question for the both of you, but we'll start with Pam because she kind of the one triggers it, and then we'll go with Anne-Laure. So how does it work? For example, I remember I came to you when you started to work in your new position. I was calculating. I was like, that's probably the timeline. I came to you about my dyslexia, and so you gave me all the steps I need to do. So how does it work? Well, like, what does a student need to do and provide you? And then I'll go with Anne-Laure because she's going to help us provide certain documents. So.
Yes, so AUP is a small university, but does have a learning accommodations program. I'm saying it's a small university because those students who come from big universities or that are used to that program in the States are used to see an office that is dedicated only to that, and we don't have that. We are able to we're able to provide a certain amount of accommodations. So those that we call academic accommodations granted are, for example, extra time for exams, a laptop when required for exams, and a separate space to avoid noise and distractions for exams. Those are like reasonable requests to AUP that we make sure we're able to provide. With remote learning, those have shifted a little bit because logically, but in normal times, those are the three that are, we have a whole team working around the logistics of those three accommodations. Then you have what we call additional accommodations, and it's everything else that a student might be recommended to have during their studies. And it can go from extra time for assignments to adaptation of the evaluation material for them or things like that. But those are things that have to be seen with the professor on a kind of like a case by case, because first of all, some accommodations that students are used to have from high school are no longer sometimes pertinent for the college level or even necessary, but also some are not possible because of the nature of the class or because of the class policy, and it's just impossible for the professor to adapt it that much. So one of the things we ask a student to do at the very beginning of the semester is to have an appointment, make an appointment with the professor to lay out this the set of academic accommodations they're registered for, the exam ones that I mentioned that it's just a matter of logistics, and the others to see which ones are reasonable to apply to the class and which are just impossible to do. When it comes to be registered for accommodations, students have to provide documentation issued by a professional, any doctor that did the evaluation and has clear recommendations of accommodations in the classroom. For example, 50% extra time for exams and so on. It has to be 3 years. The validity, it can't be more older than 3 years. And what else I'm missing? I think that's that's a
Mine, I'm
base.
gonna have to redo mine soon, so I need a refresher here.
Yeah. I guess one thing, that's it. Be in touch with Charlotte.
Yeah.
Otherwise you'll be on her blacklist. Because Charlotte, by the way, Charlotte Bernier, my colleague, is the point person for that at the counseling office, who registers the accommodations. And what was I going to say? Maybe the other thing to keep in mind is that normally this is something to request the very first semester when students land at AUP. But sometimes for different reasons, and actually they have until the dropout week, that's the deadline to submit paperwork. But sometimes the request happens later for whatever reason. Maybe they were not diagnosed before, or whatever happened. Maybe they had, I don't know, documentation that expired, but then they renewed their documentation later and they were not ready by then. Plus, they submit that later. There is a process for that too, out of deadline. So if ever someone is in that situation, they can get in touch with Charlotte. We don't, of course, recommend that students fall out of that wagon, but we do whatever we can to get the support students need in order to succeed in the academics.
So, for example, Anne-Laure, there is a student who's been here for 3 years. Is documentation is expiring. Can you help student to find other professional to get reevaluated? You guys have a list of orthophonists, for example, that can help patient for. I mean, that's my case. That's the only one I know. So that's why I'm using that example. But any example is fine.
Yeah. I had found an orthophonist. Yeah. What's the speech therapist? Is that what you say? Yeah, speech therapist. The thing is, it's a bit touchy because a French speech therapist, like they could deliver a note, but they can't. Like it's tricky because they cannot, like, the English is not their mother tongue, so they might identify dyslexia, but not exactly the
Specificity.
If the student is not French, but
Okay.
for a French student, definitely.
So it's better for any non-French speakers that if they go back home a summer or something like that, to like get re-elevated there.
I had that case before. Like, no, I had a case of a student who wasn't diagnosed and needed diagnosis, and thought, like, because one of the teacher of the student said maybe that student. So the student came to us, and I've looked for someone, and I actually found someone who was ready to see him, but she said that it's limited. What she can do is limited with an English speaking student, for sure.
That makes sense.
Yeah.
So our recommendation would always be, like, if they can go back to whoever first did their first evaluation would be better, because they know them and they follow the same protocol. If not, we'll always find ways to help them get another temporary solution to that, or maybe but our recommendation is to go back to the first one who assessed.
Well, that's very helpful, because that's definitely, like, if you come for 2 years only, if you're transfer, you don't really encounter the problem. But if you come for 4 years, you might have that problem. I mean, you're gonna run in that problem. Oh my god, my out, my in, everything is mixed up today. I think I'm gonna leave it for Alayna for a second here. I need to read.
No, that's okay.
My words are going like crazy.
No, me as well. But I wanted to touch on this because I see we're getting close to our time, and I don't want to take up your guys' whole day, although I'm sure we very much could. Pam was mentioning, or I guess not mentioning, but explaining the whole purpose of the office is like that on-campus support for especially academically related issues. but I wanted to touch on what's one of our new additions in the health office of on-campus support. So, Anne-Laure, do you want to talk about the doctor that we now have on campus?
Yeah, she's been working with us for some time, for many years actually. She was there before I arrived, and we didn't have the look, like we didn't have room enough to welcome someone, because the like at the on like the in our building we didn't have that kind of room for a doctor. But it's something that we've been thinking about for a long time, and I've like things evolved in the right way, and we were able to have that room next to our office. So now we have a general practitioner who is coming twice a week, 2 afternoons per week, and that's really great. It's really a game changer for the students. She's fully booked all the time, and it's great. No, really, and we especially need her also because we are also dealing with immunization and immunization records, and we have compulsory mandatory vaccines that the student needs to be vaccinated against DTP, MMR. And there is also meningitis, and many, like some students, but many students are not immunized, like have not been immunized against meningitis for the 5 past years, and that's what we need. AUP is asking for this. That's the regulation, and Dr. Nizar can write the prescriptions, so the student can buy the vaccine and be vaccinated by the doctor on campus. So that's really a game changer, because it makes things so easier for the students and for us as well.
Yeah, because it's everything in one location.
Yeah.
And while we're talking about vaccines, like this is a perfect leeway. Like we know a new one is up in the air right now. We talked about it a lot. So I don't think it's mandatory, but would you maybe what's the word? Encourage students to have the possibility to get vaccinated back home, to do it before they come to France? Because I mean, we know in France it's a little slow. We're getting there.
We are slow getting there, but yeah.
Better for students to get vaccinated at home if they have the possibility, or is that like not something you like? What is your recommendation regarding that?
We would strongly encourage the student to be vaccinated back at home, because we don't know, like we depend from the government and from the vaccines that are released from different labs. So we actually don't know yet, but for sure it won't be. I don't think we can force anyone to be vaccinated for sure, but we strongly recommend it for sure. Yeah, and for a foreign student being vaccinated in France, I know that right now I have 2 students who are at risk, who were vaccinated. Yeah, like it took forever to get them an appointment. Well, I know that they were great. Like both students were amazing, because they were very patient, and we kept sending them in different places, and it's very difficult right now to get vaccinated. So yeah, I would strongly encourage to be vaccinated in the US, even if it's possible for foreigners. You don't need a social security number to be vaccinated. So yeah, but I would encourage to be vaccinated back home rather than in France.
Okay, cool. And there's one last question. Maybe we can close on that. I know some students come with certain medical condition, and they are used to have certain prescription. And medication in France and back home, for example, in the US, is very much different. So help them find either doctor that can reevaluate and prescribe something they can find here, or either is a way to get the prescription from back home here. What can you do for those students like, who have those medication that they need to have? They can't. It's not a choice.
No, if they want a refill and they are under a certain medication, that is not, because some medications in the US are not available in France for sure, and not legal. So I know that some students get them shipped to them by their parents, but sometimes it's not possible. And even getting shipped, I think you need the prescription to be inside, to be with the medication to make sure that it will go through the customs.
Okay.
But if the student is running out and there is no other option, I would send that student to either to a psychiatrist or to a general practitioner, depending on the medication, and get a similar medication to be prescribed, especially when the student is running out of time. Usually the GP, the general practitioner, can prescribe a lot of things. And so there is always a way.
And that's exactly what both of these offices are here for, the health office and the guidance counseling office. So
troubleshoot office.
Yeah. And I would add to what Anne-Laure was saying, just to say that when students are dealing with something, this is something, and they have needs of whether it's medication or follow-up or anything else, it's something, it's important to plan in advance as much as possible before they land here.
Get in touch with both of the office, right, before they even arrive.
Yes, they can be in touch with both of our offices, and I see the difference with a student who prepare that in advance or as much as possible, and the one that's trying to adapt to Paris, to find resources, to get to know AUP, to understand how everything works at once. There is a huge difference in terms of how they live their experience, and they spend their first months at AUP. So as much as possible, I encourage students to prepare that in advance.
It's less of a hassle, for sure. If you can get all that sorted before you arrive, at least you arrive and you're like, okay, that part will be taken care of. I can move on to whatever else coming to me.
Yes,
you don't have to be like juggling with those two things.
Yes, and they're more available for fun stuff as well, instead of just taking care of the the admin and getting everything ready. They save some time there.
Yeah, it's better to think ahead. To enjoy the experience, the actual Paris experience, even though it's very reduced right now. But definitely they have to think ahead of that kind of stuff, because they can be stuck, and we always here to help, but so they can get rid of that and focus on something else.
Makes sense. Well, thank you so much, both of you. If any students have any health question, well-being question, you can contact admission@aup.edu, and then they can redirect you depending on what you are looking into. But thank you so much for joining us.
Thank you.
Informative, I hope, for everyone who is listening. I hope you'll come and not be stressed about coming about your health problem or anything like that. You'll be taken care of.
Yes. Thank you for coming. And just a note for our listeners, our next Wireless Wednesday is on the topic of alumni. Or alumna, I guess, is the plural. Is that?
Yes.
Yeah, it is. Okay, there we go.
I always get confused too. I was like, alumni. I was like, no, that's not it.
Yeah. So keep an eye out for that one. And I echo everything that Sandra already said. Thank you, Pam, and thank you, Anne-Laure, for joining us for this episode.
Thank you.
Thank you, ladies. And bon courage.
Thank you so
much. For the next.
To you as well. Bye. Have a great
Bye-bye.
Bye-bye.